My name is Bayowa Joan Rokani. I'm a medical practitioner and I'm here to tell you about facts about hepatitis B. Hepatitis B is a very, very deadly disease. It's spread by a virus. The virus is similar to that of HIV and they come from the very same family. But the problem with hepatitis B is that someone can catch it through body contact, handshakes, sweat. It spreads through body fluids, sweat. It can be spread sexually, but most percentages could contact it through a handshake because you may not know the status of your colleague, whoever you're working with. It attacks the liver and it results into infection of the liver itself, causing inflammation of the liver. It is spread through contact with contaminated body fluids, and that virus can live on surfaces for at least 7 days, which means it can be transmitted via objects that have been contaminated with infected body fluids like needles. Sexual transmission and injecting drugs are the most common routes of transmission of this disease. However, there are very many things that can be done to prevent this disease. There is a hepatitis B vaccine that is given in 3 doses. First of all, you go to any clinic around, do a hepatitis B test, and then when it tests negative, you're given your first vaccine. Then the second vaccine is taken a month, 30 days from the day you took the first one. The third vaccine is taken 6 months from the first or 5 months from the second. And there we know that your body has built enough memory and antibodies against hepatitis that it can fight the disease. If you really want to see that your body is immune, there is a test called hepatitis B post-immunity test. When you do that test, it actually shows that the titers of the antibodies in your blood are high and you're immune to hepatitis B virus or disease. However, if you test hepatitis B positive, it's not the end of the world. All you have to do is to go to your doctor and seek further medical advice. First of all, after testing, we shall run the liver function tests and see if it has already started affecting the liver. Sometimes the liver functions go high. Then, secondly, there is a test called hepatitis B envelope antigen. We do that test and check if it is either positive or negative. If it is negative, they keep monitoring you. But if it is positive, then the doctor will go ahead and request for a test called a hepatitis B viral load. The hepatitis B viral load looks for the amount of virus that has multiplied in your liver, what you have currently. And there is a certain quantity, which when you have, you're started on medication because this virus has to be contained. It does not have to keep spreading. Otherwise, it will cause liver failure and someone will die, because the liver is an organ that has almost most functions in our body, and it is one of the crucial organs. So after the Hep B viral load test is done, above a certain threshold, you're started on medication. The medication that treats this are ARVs. What makes hepatitis B a very deadly disease is that even when you have been given this treatment and the virus has been suppressed, it has become inactive, you're doing the follow-up and medical checkups, it can reactivate itself and become active again. The best way